As we came near to retirement in 2010, my pain was severe. I was having difficulty walking and standing. If I sat for a long time, my knee would what I call pain lock, where trying to rise, I would have severe pain. So before surgery, I was not functioning very well at all. Hello, I'm Burt S. I have had both of my knees replaced, total knee replacements, by Dr. Sunil Thacker. Prior to my knee replacements, I had been having trouble with my knees for a good number of years. Back in the late 1990s, I had some minor knee issues which were corrected by surgery, not with Seaview, meniscus tear repair and things of that nature, but I always knew that I would have increasing problems as I aged. Right. In 2011, we moved to New Jersey, Concordia in Monroe Township. We visited a couple of orthopedics. I didn't have much faith. They gave me shots, they gave me advice. And then one day, Emily said to me, we are going to a seminar at the local senior center. They have some kinds of new procedures they want to talk about regarding knee replacements. Well, I don't like seminars. I don't like people telling me what to do. But when your wife tells you, you've got to do it. So we went to this seminar. They served lunches in the bags. And Dr. Thacker presented some new developments in knee replacement. And from the things he was saying and from the information he presented, I quickly came to the conclusion that if I was going to have a knee replacement, this was the doctor who was going to do it. During the period leading up to the surgery, Dr. Thacker was most supportive. He answered all of my questions, and I can ask more questions than most people can answer. I wanted to know all of the technical details, all of the mechanical details of the knee he was going to be using, the technology involved, and he was patient and explained everything. The surgery went well from my viewpoint. I woke up in the recovery room, and Emily tells me, and I don't quite remember it, but she says I ate a complete dinner within 2 hours of the surgery, and I immediately asked for my phone and started ordering t-shirts to say, I survived total knee replacement. So my right knee was replaced. I understand Dr. Thacker had a difficult time of it because the bones in my knee, after constant and years of abuse, had toughened to the point where he said they were the toughest knees he's ever had to work with. But I was fine. When I was taken up to my room, I had absolutely no pain, and the only pain I suffered during the rehabilitation and therapy portion was when my knee was actively moved by a therapist to its limits, and that had to be done to determine how much my knee could work. After a few weeks of therapy and several months of therapy on my own, that right knee was back to what we would call normal. And I knew that in the years that would come, I would have to replace the left knee as well, because it had the same issues, the same arthritic problems as my right knee. That knee progressed slower in its deterioration because the right knee was now able to bear more of the burden, and the left knee had an easier time of it. We come to 2018, the knee was no longer serviceable, and approached Dr. Thacker. He concurred, and we determined that I would be going back to Jersey Shore Medical Center for another knee replacement. Things had changed. Therapies had changed. Concepts had changed. The one constant was Dr. Thacker and his expertise and his care. That third surgery went fine. Everything was good. Emily was taken ill and wound up back in the hospital, and my surgery was not followed by a normal rehab period. I was in the rehab facility for only 2 days, and I had to come out so that I could visit Emily in the hospital. And most of my therapy this time was self-directed on the stairs of the hospital she was in, with guidance from this therapist at Seaview. And now, a year later, that knee too is back to normal, and I have recovered my total mobility. I can now stand from a seated position without using my hands for support or giving much thought to it. For the previous years, when either knee was giving me a problem, I always had to use the arms of the chair to stand, and when I sat for a long period of time, whichever knee needed to be replaced would go into what I used to call pain lock. I would have pain and I would have to push through it to stand. I can now stand up without assisting myself and without pain. My advice to patients who are potentially undergoing knee surgery, knee replacement surgery, is don't be afraid of it. It is nothing short of a miracle when it's done. Emily, who has been treated by Seaview in the past for spinal issues, is now having trouble with one of her knees, and Dr. Thacker and she are working on a plan to have her knee replaced. For her, it might be a little easier because she only needs what's called a partial knee replacement, but she is going to undergo that probably this coming spring. We have spoken with many of our friends, many of our neighbors, and even strangers who we meet about knee replacement and Seaview Orthopaedic, and many of them have become patients. Many of them have had their knees replaced by Dr. Thacker, and they all sing his praises.
Awesome. And Emily, can you just say hi really quickly?
Hi.
All right.